Hi everyone, I'm Ariga. Kyle and I worked on this DAP project, and I will present the first part of our presentation. The topic of our DAP project is bipolar disorder, which is a depressive type. Our research question is, in patients with bipolar disorder experiencing depressive symptoms, what is the effect of combining medication with ECT and or CBT compared to medication alone, and how do these treatments affect symptoms in 2 weeks? The significance of this question lies in understanding the effectiveness of various treatment combinations after 2 weeks for bipolar disorder patients. This understanding will inform treatment decisions and improve patient outcomes. Patients with bipolar disorder 2 experience a hypomanic episode and a major depressive episode in the past or present. A hypomanic episode involves elevated, expansive, or irritable mood with additional symptoms such as inflated self-esteem, lack of need for sleep, increased talkativeness, distractibility, heightened goal-directed activity, and excessive engagement in risky behavior. These behaviors are noticeable but not severe enough for hospitalization, and they are not drug-induced. A depressive episode involves 5 or more symptoms in a span of 2 weeks. Constant depressed mood, diminished interest or pleasure in activities, significant unexplained weight loss, insomnia and fatigue every day, feeling of excessive guilty and worthlessness, inability to concentrate or make decisions, thoughts of death. These are unrelated to use of substances. Patient introduction. Our patient, Mrs. has a history of bipolar 2 disorder and she was diagnosed 10 years ago. In 2015, she was admitted to Sharp Mesa Vista for depressive symptoms related to bipolar 2 and reported having thoughts of self-harm. She has undergone over 6 sessions of electroconvulsive therapy or ECT over the past 10 years. The most recent session was over 1 year ago. The current oral medication has been ineffective in treating depressive symptoms over the last 3 months. Mental status examination, positive findings. During Mrs. Mental status examination, she displayed signs and symptoms consistent with bipolar disorder 2. She appeared sad and depressed with a dysphoric facial expression. Mrs. communicated feelings of sadness, low mood, lack of motivation, and occasional anxiety. She mentioned that she had experienced thoughts of self-harm in the past 2 months during a depressive episode, but denied having such thoughts currently. She also reported experiencing anxiety related to feeling worthless, which has affected her ability to sleep. Additionally, Mrs. noted a weight loss of 10 pounds over 3 months due to a decreased appetite caused by her depressive symptoms and self-neglect. From her current medications, Mrs. takes Vistaril or hydroxyzine palmate, which is an antihistamine. She takes this medication orally every 6 hours as needed. It has side effects such as dizziness, drowsiness, dry mouth, constipation, urinary retention, and headache. She takes this medication to treat symptoms of anxiety as needed. Her other medication is lamotrigine or lamictal, is an oral mood stabilizer. She takes at a dosage of 200 milligram every night. Its side effects include headache, dizziness, nausea, double vision, vomiting, and insomnia. It is used to manage symptoms of bipolar disorder. Her other medication, lithium or escalate, is a mood stabilizer. It reduces abnormal brain activity. The patient takes a 400 milligram oral tablet every 12 hours nightly. Its side effects include tremors, increased stress, weight gain, and hypothyroidism. She takes this medication to treat her manic depressive illness. I think I am done the first part of this presentation. The second part will be presented by Kyle. Thank you.
Thank you for getting us started, Arega. I'm going to take over on the second half of her medications. So the next one we have is her lorazepam. This is also known as Ativan. It's a PRN medication for her. So this is a benzodiazepine. The mechanism of action is to enhance the GABA. It's also used as a sedative, a muscle relaxant, and anticonvulsant, and for anti-anxiety. Her current dosage is 1 milligram oral Q6 hours as needed. Similar side effects as the other medications with the drowsy, dizziness, and weakness, fatigue, depression. The real big risk for this one, the outlier, is the risk for dependence. As we know with benzodiazepines, we can have a possibility for dependence, and that is one of the worst withdrawals and possibly deadly withdrawals that we can have. This patient is using it for her treatment of anxiety. The next one is the trazodone, which is an antidepressant by classification. It is a serotonin agonist reuptake inhibitor, an SARI. So this inhibits serotonin reuptake. It blocks the receptors here, and also has a mild alpha-1 adrenergic receptor blocker. Her prescription is 1 tablet, 150 milligrams, oral, nightly as needed. Very similar medication side effects as the other ones. The big changes here are the weight change and the potential for orthostatic hypotension. So we have to keep an eye out for potential fall risk. And this medication is being used for the treatment of depression. Okay, next up is our nursing diagnoses. So these are the following nursing diagnoses that led to the formation of our PCOT question. The first one is that the patient stated historically when her depressive symptoms have become very severe, she experienced suicidal ideation. And although she never had a plan, she stated that there were times where she wished she would fall asleep and never wake up. So this is our top priority nursing diagnosis because suicidal ideation is the highest risk symptom in patients with bipolar disorder with depression. The second nursing diagnosis that we have is that the patient is at risk for self-neglect due to depression or related to depression. Again, depression can lead to self-neglect. This is displayed by the patient's lack of appetite and weight loss over the previous months. Lack of proper nutrition can be a serious concern for these patients, and it can lead to a multitude of additional medical side effects. So inadequate nutrition can cause like a bone density loss, so accelerated osteoporosis, for which she is already a risk factor due to her demographic, impaired wound healing, and she can even increase her feelings of depression due to a lack of caloric energy. And the third nursing diagnosis that we have is that the patient is at risk for anxiety related to the depression and lack of self-worth. So the patient already expressed a high level of anxiety associated with her depressive states, and the patient noted an inability to sleep due to the anxiety. So this is also a high priority nursing diagnosis, and these symptoms would definitely coincide with her depression and could even cause her to feel a greater degree of hopelessness as well as a further decrease in self-worth. So again, anxiety is a symptom that is especially paired with depression and can lead to a greater likelihood of developing suicidal ideations. The anxiety is also negatively affecting sleep, which has been shown to worsen, again, depressive symptoms. So the main goal with these nursing diagnoses and the PCOT question was to find the most priority symptoms that can lead to a worsening of the patient's overall condition. Now, the main things that we were trying to address are potential contributing factors to suicidal ideation and how to prevent them. So our first nursing intervention and our variable with our study was the electroconvulsive therapy treatment. So the patient will receive ECT treatment and her symptoms will be monitored for 2 weeks. She will then receive subsequent ECT treatments as long as needed, depending on the doctor's evaluation. So again, this is typically the most common indication for ECT treatment is depression. The patient stated that this has been a helpful therapeutic measure for her historically. The patient is still in the initial phase of this round of ECT treatments, so she is currently receiving 2 treatments per week. The depressive symptoms, again, are number one indication for this therapy, and we will unfortunately, be able to continue to monitor the patient throughout the treatment. So we're going to be focusing on the hoped for results that are discussed above, which are that the symptoms of bipolar disorder are reduced, and that after the treatment, the patient will be assessed for suicidal ideation, depression on their depression level on the Beck Depression Inventory, and the anxiety level on a scale of 1 to 10 on a daily interval. Now, there are side effects to ECT, and the most common are short-term memory loss. Our patient stated that she has experienced this symptom with her previous ECT treatments, and it has been frustrating. But she also stated that she would rather have to deal with short-term memory loss than, quote, not being here anymore, end quote. And that basically was indicating that the ECT treatment has been effective enough for her to prevent herself from committing any self-harm or an attempt on her life. So she noted that it was an effective treatment and definitely did help resolve some of her symptoms of depression and the symptoms that would lead to SI. So our next nursing intervention will be cognitive behavioral therapy. The patient will be treated with CBT weekly, and we can measure the bipolar disorder symptoms through mental status exams each day. Studies have shown that mindfulness-based CBT effectively treats bipolar disorder by improving brain functioning. And the good news about CBT, it has not been shown to have negative side effects and will not interfere with her other treatments, such as the ECT or her medication. So our evaluation, or hope for evaluation, is that the patient's symptoms for bipolar depressive disorder are reduced. And CBT, again, is known as the gold standard for most all psychological conditions, including bipolar disorder with depressive symptoms. Given that the patient is in an inpatient setting, a regular weekly cognitive behavioral therapy and follow-up is possible. We would hope to see an upward trend in relief of depressive symptoms over the 2-week span with a positive trajectory thereafter. Now, we understand that the treatment outcomes for patients is not linear, and some days may be better than others, but we're able to track the patient's progress with quantitative data scales, such as the Beck Inventory, and that allows us to track the patient's progression over a given time period. The patient will also be able to provide subjective data on their mood, feelings, and other depressive symptoms, as well as give their anxiety level on a daily rating. These data points will be key in monitoring the success of the treatment interventions within the patient. And again, our evaluation is going to be the Beck scale. The patient is going to be assessed for SI depression level, and also an anxiety scale on a scale of 1 to 10 at daily intervals. Our third nursing intervention is going to be prescribed exercise. So the patient will engage in physical exercise at least 3 times a week. The patient reported past success in reducing her bipolar disorder symptoms by staying active and going to the gym, but her exercise routine stopped during the pandemic, and exercise has been shown as a promising lifestyle intervention for bipolar disorder. So the patient recalled a time in her life recently when she had the least depressive symptoms, and that was when she was working out regularly and was part of a fitness community at her gym. During COVID, however, she lost this coping mechanism as well as this support community. The loss of her community and her habit or her hobby was the beginning of her progression into her current state of bipolar depression. And the progression happened slowly at first, but after a few months, she said her condition was relatively severe. So even when the gyms reopened, she was to a point in her depression where she felt a lack of motivation and was discouraged from getting back into fitness after taking so much time off. She stated that it seemed like it was too large of a mountain to climb. And after a few years of living in this depressive state, But still finding some relief through medication, the patient began to realize that even her medication wasn't helping with her depressive symptoms, and this was her self-described low point, which is also around the time when she reached out to her friends and was admitted to the facility. So our hope is that through the reincorporation of exercise into her routine, we're looking to see a gradual improvement of her self-image, as well as a relief of depressive symptoms and a decrease in anxiety with no reports of suicidal ideation. And lastly, I will read through our conclusion. So the summary of our presentation is that bipolar disorder depressive type puts patients at risk for a low mood, hallucinations, and suicidal thoughts. This can interfere with daily functioning and quality of life. Choosing the most effective combination of treatments is important to improve patient outcomes. Mrs. S was diagnosed years ago, and her current regimen of medications had stopped working. It is important to use available evidence to choose the appropriate nursing interventions. So the answer to our research question is that the most effective combination of treatments for bipolar disorder is to continue medication while adding ECT when medications stop working, and to introduce cognitive behavioral therapy as well as lifestyle interventions. The benefits of ECT outweigh the risks and the side effects, and cognitive behavioral therapy and lifestyle changes do not have any significant inherent risks or side effects. And then the further implications, or the implications needed for further study, the patient should choose the combination of treatments that works best for them. So in the case of Mrs. S, she will continue to receive ECT treatment and exercise interventions in addition to her medication and the behavioral cognitive therapy. And further research is needed to understand whether the ECT treatment has an impact on the effectiveness of her medication. This last slide is just our references. Thank you guys very much for listening.